So much. And now our sixth and final, now you did hear, we're going to add an Aging and Disability Lived Experience Advisory Board. So in 2 years, you'll get to hear from them as well. But this is our sixth and final Master Plan for Aging Stakeholder Advisory Committee in existence since the 1980s. This was the first one established and the only one in statute. The Alzheimer's Disease and Related Disorders Advisory Committee provides advice and assistance on program needs and priorities of persons with Alzheimer's disease and related dementias and their care partners. Presenting on behalf of the Advisory Committee, we have Catherine Blakemore, a family member representative, and Dr. Win-Elena Conlis-Canillo with Kaiser Permanente, the Vice Chair and Chair of the Alzheimer's Advisory Committee. Please.
Thank you. I am going to take the opposite approach about the cupcakes. I'm sure you're having a sugar rush now and ready to really listen intently to what we have to say, right? Those were amazing cupcakes, and thank you for the celebration. So I want to start by just saying thank you to all of our committee members and our amazing CDA staff that helps us with the recommendations and facilitates our meeting. We couldn't do this without you, and we know that and appreciate you. Before I start with our recommendations, I want to talk about why I do this work and share my family's experience, since I'm a family member representative, about a group we haven't spoken as much about today, which is really the forgotten middle. My mom was a school teacher for 25 years, taught elementary school and did choral music, and always talked about the importance of giving back. So it's really in her memory that I have lived my life in that way of wanting to give back wherever my talents could be used. When she retired, she, in the 1980s, had a pension that allowed her to continue to live in her community and the middle-class lifestyle that she was accustomed to living to. But in her mid-80s, she was diagnosed with dementia and ultimately needed additional supports to live on her own. And as her disability became more significant, we had trouble finding and retaining staff. And I was always somewhat stunned by how much it cost her to pay for her staff and how little caregivers actually received from the additional support they provided beyond what we as a family could do. And then she began wandering, and she fell and was found outside 12 hours later, ended up in the hospital and then a nursing home, and then we were in the position of finding how do we support her on a 24-hour basis. And what we learned through that is there isn't anyone, even a school teacher with a pension, that can afford 24-hour care in California. Simply not possible. Her care cost roughly twice as much as what her pension did. So it's in that way of thinking about that experience that I have our first sets of recommendations, which is to increase options to provide care to individuals with dementia through strategies such as developing and launching a long-term services and supports benefit, establishing a voluntary savings account, setting aside a percentage of assisted living waiver slots for individuals living with dementia or other cognitive impairments, and increasing slots in the assisted living waiver, all designed to ensure that people can get the kind of care that they need. And it's my pleasure to introduce my co-chair, Win.
I'm short, so I have to. Well, it's an honor and a privilege to be the voice of the people living with dementia and their caregivers. For some of you, might have heard my story as a family member during our last meeting like this 2 years ago. Today, I'm going to share a different story. As a geriatrician and a psychiatrist, I see patients with dementia in Marin and Sonoma counties daily, except for today. For the most part, the diagnosis of typical dementia and medical treatment of the disease causing dementia is relatively straightforward than the usual recommendations, such as creating a supportive environment, managing behavioral symptoms, and providing support for caregivers. So I want to share Mike's story to illustrate this briefly. So several years ago, I saw Mike, who was 90 years old, and a retired sheriff. Mike was referred to my geriatrics clinic for a second opinion about his one-year history of short-term memory loss. He had some awareness of some of his symptoms, and he even shared that he was diagnosed with dementia by his primary care physician, and that his primary care physician took his driver's license away. That happens a lot, by the way. They would come to my ops. He was upset, stating, "I'm a great driver, have no traffic violation, I should know I'm a sheriff. Please help me get my driver's license back." He also said he was still helping his loving wife of 75 years with the household chores. Fortunately, his wife, Sarah, accompanied him to the visit. She shared that he has been obsessed about getting his driver's license back. He kept pacing every day, especially at 5 p.m. He would wake up in the middle of the night thinking he had to go to work. She hasn't been able to do much work at home as he kept following her around. When she tried to leave, he would accuse her of having an affair. She would like to keep him at home, but admitted she was exhausted. Their adult children were busy working and didn't want to bother them. This constant vigilance and accusation were really taking a toll on her emotional well-being. With their consent, I called their daughter, Mary, later in the day. She echoed her mother's concerns and added her own worries about her mother's health. She was also grappling with the financial implications of home care and the eventual need for nursing home care for her father. The impacts of Mike's dementia was not limited to him. It was a family-wide challenge. So these stories we shared are not uncommon. They underscore the need for a comprehensive care plan that addresses not just the medical aspect of dementia, but also the emotional and practical challenges faced by patients and their caregivers. So keeping these in mind, I will now present our last two recommendations. So our second recommendation is to secure funding to expand this access to dementia-capable, person-centered adult day services provided by adult day healthcare centers and adult day programs with an enhanced rate for participants with mid to late-stage dementia. With some coaching, Mike's family convinced him to attend the all-day program in Santa Rosa. This allowed Sarah to have some respite from caregiving 3 days a week. They also reported that despite Mike's decline, he continued to enjoy interacting with others and participating in their various activities, such as physical exercises, singing, and dancing. And he would actually show his dance movement when he visited me in clinic. And generally, when he returned home, he was in a better mood. So adult daycare is one of the most effective and affordable non-pharmacological recommendations. It allows persons with dementia to age in place with the necessary services and support to remain cognitively, socially, and physically active and enjoy a better quality of life. Importantly, it provides caregivers with much-needed respite from caregiving and care for their own health needs. So finally, our third recommendation is secure continued funding to expand access to the use of community health workers to provide dementia care management through the state's Aging Services Network. So fortunately, Mike's family was enrolled in our highly successful dementia care program at Kaiser Permanente Marin Sonoma. In a collaborative effort with the Alzheimer's Association and Redwood Caregiver Resource Center in the North Bay, our team guided Mike and his family throughout their journey, including enrolling him in hospice several months before his death. So many people living with dementia and their caregivers struggle to obtain information about the disease, what planning should be undertaken after a diagnosis, what supports are available, and how to access them. It's reassuring to know several evidence-based dementia care management programs exist, including UCSF Care Ecosystem Program, a telephone-based dementia care management program currently piloted in 3 counties as part of the CDA's CALS Connect program. These programs bring caregivers a sense of relief and comfort, knowing their loved ones are in good hands. This type of program also allows health systems' licensed staff to provide care at the highest level of their professional scope. So, as Secretary Bissara asked us to do earlier, let's not wait until the people living with dementia and their loved ones are broken. Let's all imagine when we meet again in 2 years, the implementation of these recommendations will significantly improve the lives of all people living with dementia and their caregivers in our state of California. Thank you. Those are our recommendations for now.